Do you have neck pain, back pain? Have you been told you have a slipped disc or herniated disc or a bulging disc? Then this video is for you. I'm Dr. Karen Drummond, owner of Drummond Chiropractic, and I'm going to be talking about the different conditions of the disc and why it might be causing your neck and back pain and how chiropractic can help. First, I'd like to talk a little bit about anatomy. Your spine consists of a bunch of bones that are separated by what we call discs. They're like little shock absorbers. These discs are hard on the outside and cushy on the inside, and they allow your bones to move and bend and cushion your spine against the activities of daily living. When people say they have a slipped disc, this is more of a layman's term to explain that they have a disc injury. The disc doesn't actually slip out of place. It's more likely to have a tear or a bulge or a complete herniation where that jelly material herniates through the outside fibers of the disc. So a slipped disc is more a catch-all phrase rather than a specific diagnosis. Now for a degenerative disc, this is when the disc gets dehydrated over time, stiffer, and can have cracks. And it doesn't necessarily mean it's painful, but if it's inflamed or if it's torn, that's when it starts to hurt. As for degenerative discs, this takes time. With extra pressure on the spine, for example, sitting too much, not moving enough, because the discs really need movement to be fed. There's no heart in the jelly to get the jelly to stir. It needs movement for that jelly to stir, bringing nutrients in and waste out. So if you're not getting enough movement, it's going to degenerate over time. Now, this doesn't mean it has to be painful. It becomes painful when it starts to inflame or gets too squished. That's when there's not enough room for the nerves, and then the nerves get irritated. Degenerative discs are more likely to cause that chronic achy pain where it hurts to sit or stand too long. But I'd like to let you know it's not your age that's causing it to degenerate. It is time and not moving enough. So unlike an iron rusting with time, your discs are living tissue. So if you resume activities like daily stretching and mobility exercises, your discs can actually reverse their degenerative process and start healing. The trick is you want it to heal faster than it degenerates. If you do, you'll improve with time, and if you don't, you'll get worse with time. Now, a disc bulge, the outer annular fibers of the disc weaken, allowing the jelly material to bulge out into it. And that can be quite painful. Basically, the disc is still intact, but that jelly material is not in its normal place. And that can affect your ability to move. It can cause inflammation and pain. With a herniated disc, that's when that jelly material herniates out of the disc. And that is when it causes a lot of inflammation because that decreases the space for the nerves, and it often causes pain to shoot down the leg or down the arm, depending on where that disc bulge is. So how can chiropractic care help? Well, we restore mobility between the bones, getting pressure off the discs, and this allows that nuclear material to re-centralize. And that's how it becomes less painful. And it facilitates healing because the more you can move, the more you can feed that nuclear material. We have special tables that decompress the spine. That way we can gently treat the disc, because if it's really injured, you don't necessarily want to be twisting or pulling on it too hard. And it's important to remember that every condition and person is different, and they may need different kinds of treatments, and we may need to co-treat with a medical provider. It's important to get the safest and most effective treatment for your specific condition. If you've been told you have a disc condition or wondering you have a disc condition, you don't have to be in pain. If you're in Bloomington, Indiana, I hope this encourages you to give us a call so we can get you on the path to wellness as soon as possible. If you like this video, don't forget to click that like button. If you find it's helpful and you want to see more videos like this, don't forget to subscribe. And until next time, stay well.